Hi, good evening. Austin Mayor Steve Adler. Got a minute? All right, so the crisis with the power and the water still is around for lots of people. People living in, say, apartment complexes. Austin water system's working, but some of the lines from the property line to the buildings still haven't been repaired. So we're doing everything we can to try to assist those folks getting back in the system. We're getting out water and supplies to folks that need it. Tonight, we're going to talk about the virus. We're going to talk about the COVID numbers. We have Dr. Escott's Tuesday data dump for folks that want to see a lot of data tonight. Tuesday's the night to see it. And I'll talk a little bit about the governor's action today to remove the mask statewide mandate on March 10th. Which frankly was disturbing news, but it is up to us at this point. But let's begin with the data. We'll start with the screen with the key indicators that we always start with. Let's see here if we have the key indicators. And we'll go ahead and take a look at these. You can see the number of new admissions is 30. That gives us a 7-day moving average of 29. This is the same number it was yesterday. Yesterday we had 15 admissions. 30 is about our 7-day moving average. 29 takes us just one below the line between orange and yellow. Remember, that wasn't a set deal. It wasn't like the first time we went below 30, we changed risk levels. But it certainly is in the area where Dr. Escott could order that if he thinks we're really holding on to that yellow stage 3 area. Today, Dr. Escott said he wanted to see through the end of the week, maybe make a decision on that as we turn into next week. But for right now, it's good to see. Real significant is the positivity. The number here used to be 9.5. It's down now to 6.9%. That's the bottom left-hand corner. That's a good sign. We still have test results that are going to be coming in the rest of this week, so that number could change. What we've seen historically is that number goes up just a tad, but even still, it's substantially below the 9.5%. Number of new cases today, 187. That's below the 7-day average of 213. This number is substantially down. That's good. We have to see if we can hold on to that. This number was down in part because we were giving so few tests during the storm. We kind of lost a lot of data there that would ordinarily we would have been having. But 187 is a good number to see. Let's go ahead and take a look at hospitalizations and the ICUs and the ventilators and compare what we're looking at today to the 7-day moving average. We look at the second dashboard on the City of Austin website page. And here you can see the number of hospitalizations. Tonight, 241. 7-day moving average is 273, so below the 7-day moving average. ICUs tonight, 73. 88 is the 7-day moving average. We're below there. Ventilators down to 56. 63 was the 7-day moving average. So all of these numbers are below the 7-day moving average. That's a good sign. And it's good for us to see. Number of deaths, 749. Yesterday, that number was 744. So we've had 5 people pass away. It's horrible that people die. It's horrible that people are dying as we're getting the vaccine out, and we're saving lives. We're getting a lot of those vaccines out to seniors in our community. We'll take a look just a second and see how many cases we're seeing in nursing homes now, compared to the number of cases that we were seeing before. All right, let's go through Dr. Escott's data. So we'll go through kind of the data dump on Tuesdays. Let's see the slides. This is the slides that the Dr. Escott and Director Hayden Howard presented to the joint meeting of the City Council and the County Commissioner's Court today. This is the chart that shows us new confirmed cases. You can see we were headed down that black area over to the right is when we were missing the data last week. Let's go down, look at the next one. This is new admissions. You can see the yellow line, the 7-day moving average, continuing to head down. The break in that line is where we lost data. This is the chart that shows us hospitalizations in the blue line. You can see it had risen really high and now has angled down pretty well. Trailing indicator to that is ICUs, which is in orange. And that's now continuing to head down. Ventilators, the last of the indicators, the gray line to actually see that headed down, but it's starting to head down now too, which is a good thing to see. The Regional Infusion Center is the treatment that the president got, the former president Trump got when he went to Walter Reed Hospital. It is for people when they first contract the virus and they're in a susceptible group to help protect against them having serious complications. This is a really good thing for people to do, and not very many people apparently know about it because we have excess capacity there. So if you or anyone you know gets the virus, you should ask whether they're considering the Regional Infusion Center. The Austin Travis County alternate care site still set up at the convention center. We're down to 32 patients as of March 1st. We've had 160 brought in and has since been discharged. The capacity right now, as we begin to limit its use, is down to about 50 right now. Here is the hospitalizations model from the University of Texas, but this is old. This is as of February 22nd, which was the most recent data that Dr. Escott had when he was doing his report. But look at, I'm going to show you, I'm going to compare the University of Texas modeling that was revised today versus what Dr. Escott showed us here that he had, but this was dated February 22nd, I think. You can see that with respect to admissions, they were predicting, the blue line off to the right, that it would basically be flat, heading down just a little bit. Same thing with respect to the census in the hospital. The same thing with respect to ICU patients. That was that data. But let's hold off for a second. Well, we're going to leave Dr. Escott's slides here for just a second. And we're going to look at the University of Texas model, which was just redone today, updated today. This is Dr. Meyer's work. We're going to take a look at the Austin dashboard. Here you can see the R factor at this point, that number to the left. R factor is down at 0.52. Which is pretty low for us. Remember, we were up to 1.52. Anything below 5 means the virus is lowering. The possibility that it's growing is only 2%. 37% fewer infections now than before. The range for the R factor is 0.51 to 0.4. But here, look at the number now. This is the chart that we were just looking at with Dr. Escott. Not flat in the same way, but going down more considerably. You can see that better in the longer term here. This is hospitalizations. You can see the model predicts the number continuing to go down. COVID patients in the ICU continuing to go down. Remember, we developed our triggers and our warnings and our risk levels all around admissions in the ICU. Wanting to make sure we never got above 200 in the ICU. That's when we would have been most stressed. You can see how close we got to the 200 line right here. We got right up to it, and we came back down. Remember, there's like a 2-week interval. So we got a signal about here just as we were entering into January. and we were telling people you have to change behaviors now. Change your behaviors now. We actually went to court against the governor. He actually took us to court. Fortunately, a lot of people became, I think, more aware of the crisis we were in. Behaviors got better. We didn't see it right away because it's a lag, but we stopped it just shy of 200. So I would say that the processes worked just the way that we had anticipated. This is a map that shows our chart that shows the R factor. Here we are down at the 0.52. But it wasn't that long ago in January when we were up to almost over 1. This was at 1.28 that day, 1.235 into early. It was December 30th, and you can see the numbers were higher in January. Let's go back to Dr. Escott's charts here so we can get the additional data. Let's see here if we can get that. All right, here we were. This was the older data. Let's continue on with Dr. Escott's slides. This is hospitalizations by age group. These are the 3 youngest groups of 10 that we can see. The blue line, the orange line, the gray line down at the bottom. We're seeing some increase in the 1 to 9 age group and the 10 to 19 age group, still relatively small numbers. You can see at the numbers at the top, the 4 numbers at the top, biggest decrease rather, with the orange line that's going down. That's people over 80. That's because I think we're doing a much better job of vaccinating in that A group. The 7 to 79 folks continue to come down, but we're seeing an increase in the 60 to 69 and 50 to 59 as a percentage of the hospitalizations. And that's in part because they don't have the vaccines yet that the folks over 80 do proportionally. Here is that same kind of numbers, but on a bar graph instead. You can see that the number of cases by age group just shows the same thing that we saw on the prior page. This is hospitalizations by race and ethnicity. We were down with Hispanic population. They were down at 35.1, about what their percentage was in the community. They've gone up to 39.5. We have to do a better job of getting the vaccinations and the information again out to those communities. That's what's happening right now with the way that we're administering the vaccines, trying to make sure that we get to the folks that are most vulnerable. Numbers up a little bit in the African American community as well. Again, where we need to figure out how to do a better job focusing and getting the vaccine. That's why we're actually reaching out to those populations right now with the call centers, trying to get to more and more folks that are homebound. We'll talk about that in just a second. This is a bar graph showing the same data that you saw just a second ago. This is an important chart. This shows the positivity in the city right now, in the county. Travis County is at 6.9%. Like I said earlier, that number could go up just a little bit because they don't have all the data yet. But look, 6.9, we were up at 16.7. This is why we're feeling a little bit better now. This is really where we started making those behavior changes at the beginning of January that started the numbers heading back down for us. Here is positivity broken out by race and ethnicity. Unspecified has the increase up to 33%. That's probably 3 cases and one of the 3 cases, so not a lot of data. But you can see, again, Island Pacific, this gray line is up, but again, few cases. But other folks headed down. American Indian headed down, Native American headed down, Asian population headed down, Black African American headed down, Hispanic headed down. So we're beginning to see those in the numbers. White populations, the purple line, headed down. This is the same thing by age group. We're trying to get to below 3%, as you recall. And the group that we have closest to getting below 3% in positivity is group over 80. You can see this part of the graph of the bar charts is the one that's had the greatest decrease. And that's because we're disproportionately being able to vaccinate folks, so they're not showing up in as many new cases. Positivity in school-age children, though, is still a concern. High school, 15.2%. Young folks, we get the virus, doesn't have often the same seriousness. But I'll tell you, a lot of people in our hospital right now are in those age groups. This is a chart that we don't usually talk about, but this every week is in the dashboard. You can find this posted. This is long-term care facilities, dashboards that look at nursing homes and other similar kinds of facilities. You can see the number of new cases in the last 14 days of folks in long-term facilities. Those were the most susceptible. That's where we were having the most deaths proportionately. Number of new cases within the last 14 days, 12. Number of new cases within the last 28 days, 57. Let me give you something to compare that to. On February 2nd, basically a month ago, this number of cases within the last 14 days at long care facilities was not 12, it was 273. And the number of new cases within the last 28 days, which today is 57. A month ago, on February 2nd, this number was not 57, it was 620. We need to get the vaccine out. We need to get it to more and more people, younger people. And now that the governor has put into question mask wearing, which we'll talk about that in a second. We need people to keep wearing their masks regardless of what the governor says. But I'm concerned about those folks that aren't even eligible, under 65, essential workers, not eligible to even get a vaccine, that might be put at risk. This is the flu map. Remember back a year ago, we were worried about what was going to happen at flu season if we saw the same kind of flu impact that we'd seen in prior years. Everybody that's out wearing a mask and distancing, it's helping with flu as well, and we've continued to hold it under 2%, which was the goal that we had set out. Again, this is the risk levels we're in orange right now. But stage 3 is between 10 and 29. We're at 29. That means Dr. Escott, if we hold it for a week, will probably move us into yellow, which means that there will be no longer a prohibition on non-essential travel. In the yellow area, it's perfectly okay to engage in non-essential travel. And it's okay to be in spaces with greater concentration of people. Still want to limit it. The governor is taking us to 100%. Dr. Escott, if we get to yellow, his recommendation is going to be 50 to 75%. Director Hayden Howard, doing the vaccines in the city, did a pretty incredible job last week with Austin Public Health. They gave out 33,562 vaccines last week. That's almost half the number of vaccines given out altogether. That was the supply we had earlier that we couldn't give out during the storms and the outages, the winter freezing conditions, plus some of the vaccines that we were newly getting. In order to be able to deliver almost 34,000 vaccines, Director Hayden Howard needed to open up additional sites, extend the hours, offer additional days, and that's what happened. Next week, we're going to open up even more additional sites. We're going to open up a super mass vaccination site at Burger Center. It's going to be drive-through. Excited that the county has opened up a mass vaccination site out at Coda, where they were able to give out 3,000 vaccines this past Saturday. We're hoping that they get a lot more supply out of that county location, that APH, Austin Public Health, gets a lot more supply that they can give out at Burger Center, but also at Delco and at Dove Springs, and a new facility opening up, hopefully in the Pflugerville area. Wanted to make sure everybody knew that they're looking at trying to clear up the backlog of people entitled to get their second dose. We've been able to do that for most of the people who got the first dose, getting their second dose. If you got a first dose, have not gotten your second dose, know that all you have to do is show up at one of the places where vaccines are being given out. Bring your CDC vaccine card with you to demonstrate that you got the first dose and you got it from Austin Public Health, and that you're beyond 42 days. And then you'll automatically be able to get a vaccine, even if you don't have an assigned time. We have changed. This is the vaccine update. The total number of vaccines, 85,000. This is just given out by Austin Public Health. Total number in Travis County, probably about 150,000 folks, probably, be my guess, is about the total number of vaccinations. But 85,000 by Austin Public Health. The age of folks pre-registered and eligible in the system still, people over 80, about just under 14,000, 70 to 79, about 44,000, 60 to 69, only those over 65 are eligible, about 58,000. We're going to get another 12,000 vaccines this week. And the state announced that they were going to get 200,000 of the Johnson & Johnson vaccines. Good news to hear that Merck, a competitor, has gotten through negotiations with the federal government and is going to be making the Johnson & Johnson vaccine that was brought forward by its competitor. It's a real good thing to see. That Johnson & Johnson vaccine is almost as effective. It's real effective and almost as effective. Almost every bit as effective as the Moderna and the Pfizer with respect to keeping people from dying or getting serious complications. All the medical advice is get whatever is the first vaccine that is made available to you, both safe, both effective treatments. We've updated the scheduling system at Austin Public Health. It has a new queuing system. We've added more employees at the call center that are calling people who can't negotiate computers, reaching folks that are homebound. So you'll get emailed when it's your turn. And you can get a scheduled appointment time as part of the new queuing process. We're focusing also now on increasing the capacity to do mobile vaccine program to get to folks that are most vulnerable and don't have the same ability to be able to get to a place where they can get a vaccine. Working with some of the organizations like Meals for Wheels that are delivering meals and know where the folks are that we need to the best reach. And as an aside, there are like 350 entities in Travis County that have been authorized by the state to give out vaccines. More and more of them are getting them. CVS and Walgreens have provided vaccines to over 11,000 people in 107 facilities. And that's a real good thing to see. So that's the information and the data. I just want to touch real briefly on what happened today with the governor. Governor Abbott announced that he was ending his statewide mask mandate effective March 10th. The mask mandate is the most effective thing wearing a mask in public or within closed spaces, the most effective proactive thing that you can do to help mitigate the spread of the virus. You wear a mask to protect those that are around you and maybe yourself as well. But if you don't wear a mask, it's just not that you're putting yourself in danger, you're putting the people around you in danger. Other than getting the vaccine, the most effective thing you can do. Almost every medical professional tells us that. I read the same stuff that you do on social media that would suggest otherwise. It is just not borne out by the vast number of medical professionals, including Dr. Escott here in town, the advisors advising the governor, and our own CDC at the national level. Texas should be guided by that science and that data. That tells us we should maintain the mask update. There is far too much at stake to compromise the positions that we have so earned just because we're getting overconfident or we have a political imperative of some kind that we need to realize. It is, our priority should be to do everything we can to increase the chances that we can get more and more students and every student into in-person learning in school. And our second priority should be to open businesses more and more and more without a substantial risk that we're going to have to pull that back. Wearing a mask would help us with both of those two priorities. Ending masking. If people don't wear masks, then we put those two highest priorities at greater risk, and we just shouldn't be doing that. Now, the governor didn't say that you can't wear a mask. He gave everybody a choice, and we have to make sure that in this community we make the right choice. I sure hope that people continue to wear masking when they're around public or they're in closed spaces. I hope that businesses continue to insist that those in their stores wear masking. That is something that we expect of one another, that we hold up the businesses that are requiring folks to mask and elevate them and support them. This is a time when our neighborhood really needs to, our residents need to help their neighbors and really pull together, just like we saw over the last couple of weeks with everybody helping each other out in this winter freezing weather we had, and the power outage and the water outage that we had, where we all pulled together with one another. That's where we are right now. Just because the governor says you don't have to wear a mask doesn't mean you don't that you don't have to wear one or shouldn't wear one. Clearly, it is the right thing to do. The Chamber of Commerce here in Austin today issued a statement also encouraging people to wear their masks, encouraging business to maintain that behavior. I sent a letter into the governor together with Judge Brown here locally, urging him not to do it, as did the mayor of San Antonio and the judge there. Calls for that today from the mayor in Houston and the mayor in Dallas, the mayor in Arlington. It's up to us now to really take care of one another, to do what it takes to increase the chances that we can get all our kids back in school and all our businesses open. Let's work on that. That's all I have for tonight. You all take care. Be safe. Good night.